Welcome to Movement and Stretching for Lower Back Pain. What to do when it strikes and tools for prevention. My name is Dani Ondreka, coming to you from Kettering Health Network. Now, we've all experienced lower back pain. There are several things that can increase our risk for lower back pain. Two of the most important being increased age or increased weight. But certainly bad posture, lack of exercise, improper form when lifting are also major components of lower back pain. Causes are all connected. Muscle or ligament strain, which can be due to improper lifting or form. Bulging or ruptured discs, arthritis or osteoporosis, which have some genetic factors in there as well. Most of the time, when we start to experience back pain, a lot of us ask, is it safe to exercise? Should I even try to move? Should I just go see my doctor? Of course, your doctor should definitely play a role if we have pain that is persisting for several weeks that does not improve when we rest, especially if we experience pain that travels down one leg or the other, or we experience a spreading numbness down one limb or the other. But most back pain will resolve itself as long as you're taking the time to rest, doing stretches, and performing light exercises that don't overstress those areas. So where does this back pain actually come from? Most commonly, it's from some sort of misalignment between the connection of your pelvis and your spine. Generally, for most people, that looks like an anterior pelvic tilt. So what is an anterior pelvic tilt? If we imagine that my fingertips are just like a belt, an anterior pelvic tilt is when this pelvis comes forward. So you can see if my pelvis starts to come forward here, I have a really exaggerated curve in my lumbar spine, and it places a lot of pressure on those muscles in the lower back. So in order to control that and pull that pelvis back into a posterior tilt, we need to strengthen our glutes and our hamstrings and also our lower core. So that plays into our muscle weakness and lack of strength. Of course, we could also have back pain from underlying medical conditions, which is why it is very important to also discuss with your doctor or another medical professional if you do have pain. So let's talk about some stretches for short-term relief. All of these can be done either seated or on the floor. We're going to start on the floor, and all of these stretches also have a seated counterpart that you can perform. In all fours, wrists underneath shoulders, knees underneath hips. You're going to take a big breath in, arching that back, looking up or ahead. This is cow. As we take a breath out, we arch up, tucking tailbone forward and chin to chest. That is cat. So as we take a breath in, we're allowing space for this air to enter the body. As we take a breath out, we are closing off that space. So allow your breath to guide that motion. Second, we're going to take a look at some child's pose sit backs. A typical child's pose has knees nice and wide, big toes together on the floor. As you take a breath out, you sink those hips back. And we're just going to come forward and back right here. If you want to come all the way down fully into your child's pose, bring your head all the way to the floor, you are more than welcome to. But for the sake of just a quick stretch here, we're just going to move forward and back, allowing some light movement in that spine. Next, we're going to thread the needle. So we're going to take one hand from this all fours position. We're just going to leave it there. The other one is going to slide up underneath the body, almost until we can lay down into one of our shoulders here, allowing that head to rest. Your goal is for your shoulder blade to move away from your spine so you can feel that stretch. Of course, wanting to do both sides there as well. We're going to do a side lying scapular opener. Lying with those knees bent, feet are in line with your hips. We're going to take both of these hands forward into prayer. You're going to slide across the body, reaching over and away. Your goal is to try to keep those feet, knees, and hips stacked, not letting them rotate away from each other, but allowing just the top portion of your spine to twist independently. Making sure we do both sides on this as well. Now let's come all the way over to our back here. We're going to do a little supine spinal twist, starting with one leg all the way out. The other will gently pull up towards the nose, not just in. We're going to lock both of these shoulders into the floor, nice and relaxed. We anchor from here, then we find an easy twist over to the side. This looks very different for everyone. Move to your comfort level, trying to keep both of these shoulders anchored into the floor. Breath out to relax. Then when you're ready, we slowly move it back up and into the center. Next, we're going to look at pigeon. Now, a typical pigeon, if you were to take a yoga class, would look like this. Squaring our hips towards the floor. Now, this is a fairly difficult position for most people to take, which is okay. All we're going to do is bend this back knee for a modified version. So if you start here with both knees up, all you're going to do is roll them to the side. The further you bring this back leg back, the more of a stretch you're going to feel. So adjust as you feel necessary. We're going to push these hips towards the floor, trying to square them up towards the ground and take that chest down towards that front leg. You're going to start to feel a stretch here in the front. Now, the further we come down towards the floor, we may also feel a stretch in the back of that front leg. We do the exact same thing on the other side, rolling those legs over, leaning forward, pressing that hip towards the ground as we feel we need to. So we can also stretch our hip flexors with a lunge standing. So to do this, we're just going to step one leg straight back. We can press that heel down towards the floor for a little bit of an extra calf stretch, and then drive those hips forward to feel a stretch here in the front of the hip. If that's not enough and we need a little bit more, we can drop that back knee straight down, lean back with that upper body, and continue to press those hips forward. Sometimes it's nice to grab a wall or maybe put our hands out in front of us for balance if we need it. To come out of this stretch, simply straighten those knees and step right back up. Same exact thing on the other side. So we've done some stretches to relieve some pain. So now we need to add in that strengthening piece to keep your pelvis in correct alignment and decrease that lower back pain. So let's look at some core exercises. We're going to start with some lower abdominals with an alternating leg lift. Now these are made easier by just simply bending our knees. Goal here is to keep our lower back flat into the floor. We're simply going to lift one leg, and the most important part of this exercise is actually going to be the lower. So we're going to lower nice and slow, tapping that floor, one side at a time, keeping that low back nice and flat even as we lower. And we should feel those lower abs start to pull and engage. We want to make sure we do that other side as well. And if we start to find that we are strengthening that lower abdominal region and that's not enough, we can also do both legs at the same time. Lowering nice and slow, maybe a little tap of the toes, and lifting without letting that back arch up off the ground. Now in the same way, a pelvic tilt will work those same exact muscles just without lifting your legs. So if that's too much for you to lift, we're just going to practice that little arch. So if we exaggerate me arching my back off of the floor here, we're going to do that exact opposite motion, pushing that back nice and flat and imagining that tailbone pulling up towards my belly button. So allow your back to relax, maybe to arch a little bit, push that lower back towards the floor, pull that lower portion of your pelvis up. That is your pelvic tilt. Next, we're going to work on some glutes. Glute strength is very, very important in keeping proper pelvic alignment. So we're going to bring those heels a little bit closer to our glutes, as close as we can get them, driving our heels to the floor. Take a big breath in. As we breathe out, we're going to raise those hips as high as we can towards the ceiling, squeezing the lower portion of our glutes and the top portion of our hamstrings. Hold for a moment and then lower nice and slow back down to the floor. Next, clamshells. Right on top of our hip is our glute med, which is also very important in pelvic alignment. We're going to stack knees, hips, and ankles, keeping the feet in line with the hips. We're simply going to open that hip just like a door and lower nice and slow and controlled. It's very important that as we open, we don't roll those hips away. We keep them stacked right on top of each other, maybe putting a little hand there just to remind you. Open and close. If you needed more resistance, you could add a band just above the knees. You could also hold a weight here if you needed just a little bit extra. Looking at more total core, total abdominals, we're going to try a bird dog motion. Starting here in all fours. The goal here is not to move your abdominals, but to stabilize them, not to let your back arch. We're going to slowly lift one leg, pointing the heel back behind us, squeezing our glute to lift. We can add that opposite arm if we're doing great there. Just practicing holding for a few seconds, not letting that back arch, but staying nice and stable. Everything's in a nice straight line. We'll switch, same thing other side, pointing that heel straight back, lifting that opposite arm, practicing that hold. The entire goal of this motion is control. All right, so here in this full plank, we're gonna imagine that space between our shoulder blades doming up towards the ceiling, pulling belly button to spine, then releasing back flat. Breath in, doming up, and releasing. We can do the exact same motion on our knees here, keeping the back nice and flat. We dome up, relax down. My neck is relaxed. I'm just pulling my belly button towards my spine and releasing. Last position, we can come here to all fours. Exact same motion, doming up, relaxing nice and flat, needing to concentrate a little bit more on squeezing the pelvis here, squeezing the abdominals. At the end of the day, pain is your body politely asking for a change. So if you are experiencing lower back pain, your body is going to continue to tell you that it's in pain until you make that change, until you make that fix. So we hope that you have learned some good tools, some good skills to use in your everyday life to prevent and get rid of lower back pain, and we'll see you next time.